Man contracts flesh-eating bacteria near Annapolis. What you need to know. A shocking encounter with flesh-eating bacteria. A cautionary tale. An individual from Annapolis, Maryland, is currently on the mend after a harrowing experience with what is often referred to as flesh-eating bacteria earlier this month. This alarming incident occurred when he accidentally cut himself on a bait trap that had been submerged in waters leading to the Chesapeake Bay, exposing him to a dangerous bacterium known as Aeromonas hydrophila. This information was reported by Chesapeake Bay magazine. The consequences of this encounter were severe, ultimately resulting in hospitalization, where he underwent surgery and received antibiotics to save his leg. Dr. Amesh Adalja, an infectious disease expert at the Johns Hopkins Center for Health Security, explained, infections caused by Aeromonas primarily target those with weakened immune systems. He emphasized that open wounds provide an easy entry point for these bacteria. If you have any underlying health issues or are immunocompromised, it's crucial to exercise caution when in any body of water with an open cut, he advised. Your immune system might struggle to fend off what would typically be a minor issue for most people. Interestingly, such infections are not common, which is why severe cases often make headlines. They are relatively rare. Aeromonas hydrophila is typically found in both fresh and brackish waters. While various strains of Vibrio, which can also cause flesh-eating diseases, are prevalent in brackish environments like the Chesapeake Bay and its tributaries. These Vibrio strains can also be located in coastal bays near Ocean City. Dr. Hadalja noted, this bacterium can lead to skin infections in some individuals and can also cause gastrointestinal illnesses. However, severe cases, including necrotizing fasciitis, are usually seen in those with compromised immune systems who have been exposed to contaminated water with an open wound. In response to such risks, the state of Maryland has placed warning signs about bacteria near access points to these waters, even though infections like this are uncommon. Residents are strongly advised to avoid contact with these waters if they have any cuts or scrapes. The Maryland Department of the Environment recommends that individuals keep any open wounds away from water and, in the event of contact, to wash any cuts or scrapes with soap and water immediately. Dr. Adalja further cautioned, if you notice signs of infection such as redness, pain, swelling or drainage, seek medical help promptly to prevent the situation from worsening. In this particular case, it was reported that the man required skin grafts over nearly his entire leg and continues to receive ongoing treatment. This incident serves as a stark reminder of the hidden dangers lurking in our waters. Have you ever considered the risks associated with swimming or wading in natural bodies of water? What precautions do you take to protect yourself from potential infections? Share your thoughts in the comments below. Rising cases of flesh-eating bacteria in Florida. How to stay safe. A disturbing rise in flesh-eating bacteria cases in Florida. How to keep yourself safe. In a shocking turn of events, the Sunshine State has seen a surge in the number of cases involving the notorious flesh-eating bacteria Vibrio vulnificus. This alarming increase has prompted the Florida Department of Health to issue a warning and provide guidelines on how to protect oneself against this deadly microorganism. According to recent data, the number of reported cases has escalated to 13, with 4 fatalities recorded so far. These incidents have occurred across various regions of Florida, including Bay, Broward, Hillsborough, Polk, and St. Johns counties. 2 new cases have recently emerged in Bay and Okaloosa counties, raising concerns among health officials and residents alike. But here's where it gets controversial. Some experts argue that the rise in cases may be linked to climate change, as warmer waters create ideal conditions for the bacteria to thrive. However, Others suggest that increased human activity in affected areas could also contribute to the spread of the infection. Let's delve deeper into what Vibrio vulnificus is, its symptoms, and most importantly, how you can safeguard yourself against this potentially fatal bacteria. Understanding Vibrio vulnificus, the flesh-eating bacteria. Vibrio vulnificus is a type of halophilic bacteria, meaning it requires salt to survive. It naturally inhabits warm seawater and belongs to the Vibrio family, which includes other notorious pathogens like cholera. Although infections are relatively rare, they can lead to severe illness or even death, particularly in individuals with weakened immune systems. Infectious disease specialist Dr. Edward Hirsch explains that while most people with healthy immune systems can typically recover without major complications, those who are immunocompromised are at higher risk. The worst cases are if you are immunocompromised. If you've got a normal immune system, you should do fine, he reassures us. Symptoms of flesh-eating bacteria infections. Recognizing the warning signs. Identifying the early signs of a Vibrio vulnificus infection is crucial for prompt medical intervention. The primary indicators include blistering and swelling at the site of infection. According to Dr. Hirsch, the infection can rapidly progress, causing further damage to the affected area. Other common symptoms to watch out for include diarrhea, vomiting, abdominal pain, fever, chills, a rapid heartbeat, confusion, and disorientation. If you experience any of these symptoms after exposure to warm seawater or consuming raw shellfish, seek medical attention immediately. Preventing flesh-eating bacteria infections, tips for staying safe. To minimize your risk of contracting Vibrio vulnificus, follow these preventive measures recommended by health officials. For immunocompromised individuals, it's advisable to wear appropriate footwear to avoid cuts and injuries caused by sharp objects on the beach. Dr. Hirsch emphasizes the importance of not swimming with open wounds, as this significantly increases the likelihood of infection. Avoiding flesh-eating bacteria in shellfish. Safe handling practices. Consuming raw or undercooked shellfish poses a significant risk of Vibrio vulnificus infection. To ensure your safety, adhere to the following guidelines. Refrain from eating raw oysters or any other raw shellfish. Thoroughly cook shellfish, such as oysters, clams, and mussels, before consumption. When cooking shellfish in their shells, boil until the shells open. Then continue boiling for an additional 5 minutes, or steam until the shells open, followed by 9 more minutes of cooking. Discard any shellfish that do not open during cooking. Boil shucked oysters for at least 3 minutes, or fry them in oil for 10 minutes at 375 degrees Fahrenheit. Prevent cross-contamination between cooked seafood and raw seafood juices. Consume shellfish promptly after cooking and refrigerate leftovers. If you have open wounds or broken skin, avoid exposing them to warm salt water or raw shellfish harvested from such environments. Wear protective gear such as gloves when handling raw shellfish, and this is the part most people miss. While taking precautions is essential, it's equally important to stay informed about the latest developments regarding Vibrio vulnificus outbreaks. Regularly check updates from local health authorities and heed their recommendations. We invite you to share your thoughts on this issue. Do you believe that climate change is playing a significant role in the rise of flesh-eating bacteria cases? Or do you think other factors are at play? Let us know in the comments section below. Deadly flesh-eating bacteria kills 4 in Louisiana. What you need to know. A wave of concern has swept across Louisiana after a notorious flesh-eating bacterium has claimed 4 lives, and the situation is raising eyebrows across the Gulf Coast. Imagine something as simple as a swim or a seafood meal turning deadly. This is the reality with Vibrio vulnificus, a fast-acting bacteria flourishing in warm coastal waters and raw shellfish. Let's dig into the numbers, because they're alarming. In 2025 alone, Louisiana has seen 17 confirmed cases of Vibrio vulnificus infections, according to health officials. All so severe that every patient landed in the hospital, and 4 tragically did not survive. In stark contrast, past years typically saw only about 7 cases and 1 death in the same time frame. Clearly, something has changed, and the stakes are higher than ever. But here's where it gets controversial. Many folks believe only ocean swimmers are at risk. But in truth, the threat goes far beyond splashing in the waves. Nearly 75% of recent infections in Louisiana affected people with open wounds, even a minor scrape that came into contact with seawater. In neighboring Florida, the trend is just as unsettling. 13 infected, 4 deaths, all in 2025. State health authorities emphasize that you don't even have to submerge your body. Simply preparing raw shellfish with an unnoticed nick on your finger can result in a critical infection. Who is most vulnerable? While anyone can become infected under the right conditions, people with compromised immune systems, such as patients with liver disease, cancer, diabetes, HIV, or those undergoing immune-suppressing treatments, face the greatest risk. For these individuals, an encounter with Vibrio vulnificus can rapidly escalate into a life-threatening situation. The symptoms are nothing to take lightly. Some experience digestive distress with diarrhea, nausea, stomach cramps, fever, and chills. Others suffer from traumatic wound or bloodstream infections that can cause skin blisters, tissue destruction, and, in severe cases, require amputation or even result in death. And this is the part that most people miss. According to the CDC, about 20% of people diagnosed with Vibrio vulnificus die, sometimes within just 2 days of the first symptoms. It's a sobering statistic that's hard to ignore. So how can you protect yourself, especially when the warm coastal waters of the Gulf are an irresistible draw from spring through the fall? Health experts recommend that you steer clear of salt water or brackish, partially salty water if you have an open wound. Or be sure to cover it securely with a waterproof bandage. Properly clean and disinfect any cuts or scrapes that may have been exposed to water or raw seafood. When handling raw shellfish, especially oysters, always wear protective gloves to avoid contact with potential bacteria. Refrain from eating raw or undercooked oysters and other seafood, particularly crucial if you're in a high-risk category. Always wash your hands thoroughly with soap after handling seafood. For additional details and prevention strategies, health agencies encourage visiting official CDC resources. But let's open the floor. With summer traditions like seafood boils and trips to the coast at stake, are these precautions overblown? Or do rising numbers and the speed with which this infection can turn deadly demand even stricter safety guidelines? Do you personally think the public risk is being exaggerated? Or is this a real threat we need to be talking about more? Share your thoughts below. Do you agree with the warnings, or do you see room for debate? The conversation doesn't end here. How we manage this rising health threat is up to all of us.